Hello everyone. This mini lecture is on Dan Xie Gan Tang, also known as Dan Xie Gan decoction to drain the liver. The formula is from the Cal formula list. I will summarize the pattern, a short patient case, 3 clinically important drug-herb interactions, and a practical management plan. Traditional use. Dan Xie Gan Tang belongs to the category clear liver, or gallbladder fire, and damp heat. The formula is selected by pattern, not just by disease name. In this presentation, the goal is not to prove that herbs replace medication. The goal is to show how a practitioner thinks about benefit, risk, and communication with the patient's physician. Case patient. 38-year-old female with recurrent urinary burning, bitter taste, irritability, migraine, and hypertension. Medicines. Losartan, atorvastatin, and oral contraceptive. The pattern diagnosis is liver and gallbladder damp heat. Tongue red with yellow greasy coat. Pulse wiry rapid. This gives a reason to consider the formula, but it also creates the need to check her or his medication list before recommending treatment. Interaction 1. Gan-cow and antihypertensives. Mechanism. Licorice can oppose blood pressure control and lower potassium. Clinical significance. Moderate in a hypertensive patient. Management. Identify high-risk patients, avoid duplicate herbs, and monitor symptoms and objective values when relevant. Interaction 2. Diuretic or draining herbs and kidney-sensitive drugs. Mechanism. ZI, mutant-type draining strategy can increase urination and may matter with dehydration or kidney disease. Clinical significance. Moderate if UTI symptoms reduce fluid intake or kidney function is abnormal. Management. Counsel the patient on warning signs and coordinate with the prescribing clinician if the medication has a narrow safety margin. Interaction 3. Bitter cold herbs and statins or liver history. Mechanism. Very bitter heat-clearing herbs may cause GI upset. Monitor liver symptoms when combined with hepatically metabolized drugs. Clinical significance. Low to moderate. Use conservative duration. This interaction may be less certain than the first one, but uncertainty is still important because patient safety comes first. Management plan. Confirm no kidney infection red flags. Avoid use in pregnancy unless supervised. Use short duration. Hydrate. And monitor BP, GI upset, rash, and urinary red flags. I would also document the formula, dose, product brand, start date, stop date, and all current medications. If red flags appear, the formula should be stopped, and the patient should contact the physician. Conclusion. Dan Xie Gan Tang may be useful when the pattern fits, but the safest clinical approach is a short monitored trial, clear patient education, and communication with the physician and pharmacist. Thank you.